comes out because of the inflammation. But after doing the oral, when you give oral hygiene instruction, or when you do the scaling or oral prophylaxis, then after some time what you will notice that when you probe there is no bleeding. So it's the tissue response to oral hygiene instruction is best assessed by reducing tendency to bleed on probing the gingival margin. Okay. So next question, the gingiva appear on the radiograph as. Since the gingivitis is an inflammation of the soft tissue only and it does not involve the supporting tissue, so there is no radiographic changes seen in the patient with gingivitis. So what we no observed changes. Okay. Now question number 3, radiographs are of great value in diagnosing the periodontal disease because they reveal the widening of periodontal widening of lamina dura. ओके, रेडियोग्राफ्स क्यों इसमें हेल्पफुल होते हैं? बिकॉज दे विल रिवील द वाइडनिंग ऑफ द lamina dura. Okay, they do not reveal the pockets or soft tissue lesion or anything, but what they will reveal, fuzziness or break in the continuity of lamina dura. नेक्स्ट आ जाते हैं हम क्वेश्चन नंबर 4 पे, विच सेज DNA probes. So DNA probes, they are used for some particular microorganism identification. Okay, the DNA library, they may be include the probes for Porphyromonas gingivalis or Actinomycetum comitans or Fusobacterium nucleatum. Okay, like this. So these DNA probes, they identify a particular organism. Okay, this is B, not C. Now question number 5, if the pocket depth is 5 millimeter and the gingival recession is 3 millimeter, then the total loss of the attachment is, it will be 8. If the pocket depth, like agar we will talk about, this is tooth and this is the pocket depth, this. Okay, pocket depth and this, and the gingival recession is, and gingiva is also receded by 3 millimeter. So 5 plus 3, it's 8. Loss of attachment will be gingival recession plus pocket depth. Okay. Now next question. While using a periodontal probe to measure the depth of the periodontal pocket, the pocket will be measured from the junctional epithelium to free gingival margin. Okay. Because the pocket depth, it's the distance between the gingival margin to the base of the pocket. Okay. 7th पे आ जाते हैं हम, which says unbalanced insulin dependent diabetes which leads to accumulation of the ketones is associated with one of the following character of breath, odor or smell. So it's C, smell of rotten apples. So there are various disease which define these smells. Like the smells of rotten apple, it will be seen in unbalanced insulin dependent diabetes. Sometimes the smell of sulfur, it can be of liver origin. Fish odor, kidney insufficiency. Okay. So next question, mobility of the tooth is measured by, the mobility we will measure with periodontometer, and this I told you in period synopsis also. Okay, mobility of the tooth is measured using periodontometer. Next, a perio test. Perio test is used for detect, this one also I told you in perio synopsis, that if you want to check the mobility, periodontometer, and the test, perio test, it is used for detecting the tooth mobility. Like if they ask which test. Now next, question number 10, which says, in the radiographic assessment of the periodontal disease, information cannot be obtained is morphology of bone deformities. Okay. Crown root ratio, we can faulty restoration, approximate bone height, but not the morphology of the bone deformities. Next, diagnosis of the bone defect is accurately by surgical exposure. Okay, it's if you want to accurately diagnose the defect, then you have to expose that area. Okay, surgical exposure will be there. Now prognosis is good in 3-wall defect. Okay, this also we discussed earlier. Okay, next, a 25-year-old is too young to have an advanced probing depth, but her youth favors a good prognosis. Statement correct, but the reason is false. Okay. For a younger patient with rapid bone destruction, the prognosis is considered as poor because of shorter period in which the bone loss has occurred in spite of greater bone reparative capacity. That's okay. That's why the sentence statement is correct, but the reason is false. If you're not getting anything or you are getting any problem or and you are stuck on any question, just comment down. Okay. Now 14th, a standard force for evaluating periodontal pockets that have been found to be well tolerated is, this is question number, this is 0.75 Newton. Okay. Radiographically, the level of normal interproximal alveolar crest is related to it will related to the position of the cemento-enamel junction of the approximate tooth. Okay, if you want to check the levels of normal interproximal alveolar crest radiographically, so we have to relate it to the position of the cemento-enamel junction of the approximal teeth. Okay. Now, question number 16, which can be determined most accurately by radiograph alone. So, anatomic root length you can measure accurately by radiograph alone. Next, which of the following pocket offers best chance for bone regeneration? So, it will be 3-wall intrabony pocket defect. Okay. Next 18 पर आ जाते हैं हम लोग. The percentage of upper and lower first molar where furcation enhanced diameter is narrower than the width of the conventional periodontal curate is. So it will be 58. ये just हम लोग को याद ही रखना है. Okay. Now, question number 19, which says the first radiographic sign of periodontitis is, it's the loss of lamina dura. अभी मैं बताया अभी है. Okay. Fuzziness or break in the continuity of the lamina dura is the first radiographic changes in periodontitis, but there is no changes in gingivitis. Remember, okay? Now, computerized periodontal probe is, so it's a Florida probe. Okay, there are 3 classes of probe. First, conventional, first class. Second class ये है pressure sensitized. 3 are automated. ठीक है, आप ऐसे भी रख सकते हो इसको CPA. ओके, कन्वेंशनल, प्रेशर सेंसिटिव, A फॉर ऑटोमेटेड. याद रखना है आपको. ऑटोमेटेड में भी फ्लोरिडा प्रोब, दे आर कंप्यूटराइज्ड. फोस्टर मिलर प्रोब, दे डिटेक्ट CEJ. बहुत क्वेश्चन आता है ये भी कि कौन सा प्रोब CEJ को मेजर करता है, मतलब ऑल्सो कैन डिटेक्ट द CEJ. तो इट्स फोस्टर मिलर प्रोब. ओके. The probing pressure applied by CPITN probe, so it's 25 grams. Next, which radiograph technique gave 3-dimensional view of the alveolar bone defect? So it's OPG. Oh, sorry, not OPG. Wait. It's so it's a spiral computed tomography. Okay, spiral computed So it's a spiral computed tomography. Okay. So next question is 23, which says the electronic probing system Foster Miller probe detects. अभी मैंने आपको बताया था, आप देंगे इसका आंसर, बताइए. It will detect the CJ as well as the pocket depth. Okay, cemento enamel junction बताता है ये. ठीक है. Next 24, an advanced diagnostic technique which has been suggested as an alternative to culture method. So it is phase contrast microscopy. Now, next question. Other major to record periodontal inflammation is periotemp. Okay. 26, recently advanced diagnosis of the periodontal organism is nucleic acid probes. These are the recently advanced diagnostic instruments. Okay, nucleic acid probes. Now 27, true for effect of smoking on prognosis of periodontal disease following scaling and prophylaxis is. So there will be reduction in the negative influence of smoking due to increased level of plaque control. Okay. Next. If you don't get now why this answer, matlab you are still not getting why this is, so you just comment down. Okay. The following affect the prognosis of the periodontal. The following affect prognosis of the periodontal treatment. So root concavities. Okay. These will affect the prognosis of the periodontal treatment. Each of the following drug regimen is likely to influence periodontal treatment planning, except, so what all will affect? Dexamethasone, dicomarol, and nitroglycerin, but not diphenhydramine. Okay. There is no effect of diphenhydramine on periodontal treatment. Now prognosis is the estimation of likelihood or likely course of the disease. Now oral malodor is detected by, it will be detected by gas chromatography standard. Okay. Question number 32. According to Miller's classification of increased tooth mobility, grade 3 would be, so it will be mobility in horizontal as well as in vertical direction. Okay. There are 3 grades in Miller's classification. Grade 1, in which there will be slight mobility which will be less than 1 millimeter. Less than 1 millimeter mobility. ठीक है. Grade 2, mobility more than 1 millimeter in horizontal direction. And 3 में आगे जाएंगे हम, mobility more than 1 in horizontal direction and also in vertical direction. Okay. Question number 33, bone sounding done in modern times is performed by which method? So it will be by CBCT method. Question number 34, when assessing tooth mobility, the best indicator is, so what is the best indicator? It's the root displacement within the remaining periodontal ligament. Okay. Next, which of the following is correctly matched for, ये मैंने आपको बहुत अच्छे से पढ़ाया था, किसमें, जब मैं आपको साइनॉप्सिस समझा रही थी कि कौन सा फेस कौन सा है. Okay. So which of the following is correctly matched? It is phase 3, which is restorative phase. Okay. इसमें सबसे पहले आता था preliminary phase, फिर आता था phase 1, which is non-surgical phase. Okay. फिर आता था surgical phase, which is phase 2. फिर आता था restorative phase, which is phase 3, and maintenance phase, which is phase 4. So here only one is correct, which is phase 3 restorative. Okay. मिलते हैं नेक्स्ट वीडियो में, तब तक आप अपना रिवाइज भी करते रहो, कोई प्रॉब्लम हो तो नीचे कमेंट कर दो। ओके।